Juvenile lupus, also known as juvenile systemic lupus erythematosus or juvenile SLE, is an autoimmune disease in which the body produces antibodies which attack its own cells. This causes inflammation and subsequent damage to multiple organs, including the skin, joints, kidneys, the nervous system, heart, and lungs. Though the exact cause of lupus in children or adults is unknown, a combination of genetic predisposition and environmental factors is thought to be the source. Lupus and other autoimmune diseases often run in families and in susceptible people. Sunlight may trigger the disease. Today on your regular Health Talk TV show, The Physicians, we'll be discussing juvenile systemic lupus erythematosus. Stay tuned, we'll be back after the short break. It's another day with the physicians where your health is our business and will always be our business. Today we'll be discussing juvenile systemic lupus erythematosus. My name is Dr. Martina Agbere, and with me as usual is our regular, always beautiful doctor.
I'm Dr. Yusuf Kadri. Welcome to your favorite health TV talk show, The Physicians, where your health is our business.
Now we're talking about juvenile systemic lupus erythematosus. Sometimes the program
juvenile systemic lupus.
Okay, it's juvenile SLE. But there was a time we were also talking about
juvenile JIA,
so
idiopathic arthritis
in children, and juvenile idiopathic arthritis. Now we're talking about juvenile SLE. SLE is systemic lupus erythematosus. And now it's juvenile. We already discussed about the systemic lupus erythematosus in adults.
Yeah.
Now we're talking about children. So it looks like some of these disease conditions that you find in adults are also more in children. Okay.
Yeah.
So have you had any
particular cases? So I've seen. So this is where my own first experience with a juvenile SLE came from. So I have a friend who has SLE.
Okay.
You know, and she discovered it when she was over 40 years of age. But she has two younger kids, teenagers, because of the fact that she is seeing a rheumatologist, you know, and she's receiving treatment. It was through that avenue. One of them followed the mom to the hospital. So more like accidental finding.
Oh.
Or like accidental. So because it wasn't something that they were looking for. No. So no, even if there were symptoms, but the mind didn't go that there was something that the children would even experience.
Okay, you know what? The last time we actually talked about systemic SLE in adults, we had to do part 1 and part 2. Okay.
You are right.
Now we are going to talk about it in children. I think we should just hold on.
I'm happy I will have the best person to take this topic coming on board.
Let's let the cat out here, right? We're back after the short break. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.
Welcome back to your regular health TV talk show, The Physicians, where your health is our business. We're discussing, like I said, juvenile systemic lupus erythematosus, and in the studio with me is our very cerebral consultant, pediatric rheumatologist. She's no other person than our very, very intelligent cerebral Dr. AYODELE FALEYE. She is the first pediatric rheumatologist in Nigeria. Even as we speak, she's still the only rheumatologist that we have in Nigeria. Of course, in West Africa, understand that there are just 2. You can imagine how we managed to bring her here, but we've actually kept her in our museum, so we just brought her back now. So, welcome to your program, Dr. FALEYE.
Thank you.
Welcome again to our
Thank
program.
you so much.
You're welcome.
Yeah, thanks for that kind introduction.
It's always very exciting when we have you.
Gorgeous.
We know that you are still with us, and we're hoping and praying that you will not leave us, because you know we don't have many of you yet. So we're talking about juvenile systemic lupus erythematosus. So do you want to just give us the definition? What is juvenile systemic lupus erythematosus?
Yeah.
Just give us a general overview before we go to the causes and the symptoms.
Thank you. Thank you. For the purpose of this discussion, let us say that we are talking about lupus in children.
Okay.
So many people may not like that long name,
yeah,
juvenile systemic lupus.
It's
Some will just switch off once they hear that very long name. Yes, just say lupus in children. Yes. So when we talk about lupus in children, we are talking of a very severe, lifelong, life-threatening autoimmune disease that affects almost all the systems in the body. When we say autoimmune, that means the immune system is fighting against the body instead of protecting the body. But in lupus, it's as if a war has been declared on every organ in the body. The brain, the heart, the lungs, the kidneys, the skin. Now for the brain, that means a person that is complaining of headache all the time, or seizures, convulsions, recurrent convulsions, and a person with irrational talk. But now we are not just talking about a person, we are talking about a child, someone less than 18 years old, you know, with this kind of manifestation. Beyond the brain, we can have fluid accumulation in the heart, in the lungs, and some other manifestations within these organs, like bleeding into the lungs and dying immediately. Then also we can have kidney failure from lupus. It's a gradual thing, you know. The kidney will be leaking what we call protein gradually. It's not what the eyes can see, but the parents may tell us that, oh, when my child pee or when my child urinates, it forms like soap, which shows that there is leakage of protein in the urine. Then for the skin, we can have rash of any type, whether flat, raised rash, or probably the one with fluid or not, whether big, irrespective of the size, or we can have hair loss, areas where you are expected to have good hair distribution, like the scalp, the head, there won't be hair on it. So this is like almost all organ in the body is affected. And not to forget that we are doctors that treat pediatric rheumatic diseases. Something cuts across, that is arthritis. They can have swelling of any of the joints, and that means that swollen joints that could be persistent and that is associated with stiffness, especially in the morning when they just wake up or after sitting down for a long time. So by the time they start to stretch all around, they overcome the stiffness, or by the time they get up from the sitting position, they overcome the stiffness. So this disease is a very difficult one, very complex one to manage, especially in children. When you compare adults to children, children have worse prognosis compared to adults. The disease, lupus, is very aggressive in children. It progresses faster, and if diagnosis is not made on time, mortality is high. Let's look, don't let us even go to complications yet. I'm worried about mortality. Because most times with delayed presentation in lupus, most times it's about mortality. It's not even now about what the child needs to live on, live with throughout life, but it's about deaths if they do not present on time. So it's like a big war against the body.
You talked about the body fighting itself. That is an autoimmune condition, right?
Yes.
What can make a body fight itself in children like that? What is responsible?
Lupus in children most times is of like a genetic predisposition. They've been born with maybe an abnormal gene most times. It has a more maybe a family background or like heredity undertone compared to what we have in adults. Though we have other triggers like environmental factors, exposure to some viral infections. Literature documented it that after COVID, in some clinic all over the world, they diagnosed more cases of lupus We don't know the...
After COVID?
Yes, or during COVID. Okay. You notice that there is increase in the diagnosis of...
what
yes.
do you think was
it could have been triggered by the virus.
Okay.
Then some had COVID. After the COVID, they came down with lupus. There are a few cases like that in literature. So there are some other triggers like, exposure to chemicals, and then being a female child, with high level of estrogen. Estrogen has been found to be immunogenic. That means can trigger the immune system to start acting in an abnormal way. Now, when we say the immune system is acting in an abnormal way, what are we talking about in lupus? That means they produce antibodies. That's one thing about lupus. It's a disease that has antibodies.
What antibodies for the purpose of our audience?
Yes, antibodies. These are, let me say, substances produced by the body to protect the body. Yes, to fight germs and everything. And every bad substances we come across, either through inhalation, breathing, touching surfaces, and things like that. But in lupus, the individual stop recognizing itself and produces bad antibodies. Let me use that word, bad. Antibodies that can destroy the body. Yes, and that is and that is what we look out for when we want to diagnose them. We take blood samples, we check for those bad antibodies to confirm that, oh, this is actually lupus. So I think
I think this is getting clearer, because that's where people will like, is this supposed to be a medical condition? But we are breaking it down very relatable to people, for our audience, and even us here in the studio, to understand that this can happen. But of course, it has some genetic undertone. Yes. And then, of course, the fact that this child is 18 years below. Yes. And sadly, being a female is also at risk because of the estrogen and other. So how do they present? What is the presentation with regards to the signs, the symptoms? What should they even watch out for? And at what point do they need to see you? Because this is, for me, this is the biggest that we should look at. Because if I get a child in my hospital now, I mean, it's okay, this is just a whatever pain, this swelling here and all that, and say, okay, come back in 2 weeks' time. But I need to know these telltale signs and things, indicators. I would say, no, please, Dr. FALEYE is a pediatric rheumatologist that will deal with that. Yeah.
Thank you so much for that question. Let me talk about the symptoms. It starts from some of the symptoms and signs that I've mentioned while defining it. Whenever we have any individual losing their hair without cutting it or going to the barbing salon, it's just falling off. You comb in the morning and the floor is full. That could be one of the symptoms. We've had children that presented with just ear loss, and it turned out to be lupus. Then they have a characteristic skin rash that we call butterfly rash, though we can find it in another disease entity, but that's not the topic for today. But that rash distribution is around the cheeks. It spears those folds close to the nose, and it goes over the nose. But because we are blacks, we will not really recognize the color. It's usually red, That is what we call the butterfly rash. They could have that. But unfortunately, not all patients with lupus will have butterfly rash for you to know that this is lupus. Then now they have what we call mouth sores, wound in the mouth. Any part of it, maybe on the lips, and inside the lips, inside the mouth, upper part of the mouth, they can have this. Then they can have we can have chest pain, they can have cough. Then it could be that the child is just presenting with just anemia, pallor, just always pale and being transfused.
So unexplained.
Yes. You see, lupus is a masquerade disease, especially in children, because most people will think, that's a big diagnosis. Why will you have that one on your mind for this kind of little girl? You must be a wicked doctor. But that is not the truth. It's a masquerade disease. You can see the clothes of a masquerade, but you don't know who is under the clothes. That is how lupus presents. So it could be anything. You are transfusing all the time. You are not sure of what you are treating. A child that keeps going to the dermatologist all the time because of a particular rash could be a case of lupus. So any type of presentation that is not clear to a physician could be lupus. Then don't forget arthritis too. Then sometimes these individuals, they react to light. When they go under the light and you have appearance of rash on the skin, it could be a case of lupus.
Yes.
So for the purpose of our audience, so that I can understand it much better,
Yes.
I think if you can actually take it systematically.
Okay.
Funny enough, we're talking about juvenile systemic lupus erythematosus. So we can take it systematically from the the nervous system, neurological system, then go to the cardiovascular, the gastro, since it affects all the parts of the body.
Yes.
So let's go. So we can
Thank you for that question. Yes, I'm still saying that this is lupus in children. Let's just avoid that.
Yes, lupus in children.
Lupus in children. So starting from the
name.
central nervous, that means you are talking about the brain.
Yeah.
That we can have a recurrent headache that is persistent. It doesn't respond to any pain reliever or any medications for headache. You know, the child will not respond. They can have recurrent convulsions that you will think probably, yes, some will think it is epilepsy. Then we can have irrational talk. Then poor school performance. It's as if, you know, it can affect cognition. Yes, so there could be poor school performance. Then when you look at the chest, we will think more about the lungs and the heart. That means they can have cough, they can have chest pain, and then they can have difficulty with breathing. They can feel tired easily while walking or trying to climb or exert. They are easily tired because there could be fluid accumulation in the lungs or in the heart. Then also something cuts across generally, and that is what we call constitutional symptoms. They are always tired. Fatigue, a child that is not interested in the environment. They don't have interest in food. They have poor appetite. Then also they lose weight that people may think more probably is this HIV or TB. They keep screening them for HIV or TB most of the times. Then for the musculoskeletal system, they can have joint swelling, joint pain, which is arthritis or arthralgia. There could be joint pain all the time or joint swelling. Then we should not forget our skin rash. Then for kidney failure, they can start having early morning facial swelling. That means around the face, you will just know that it is swollen, and as the day goes by, it gets better. That means complication is setting in with the kidneys as a result of lupus. So, and I will still say this, that we can't exhaust the symptoms of lupus. It could be anything.
We can't exhaust the symptoms. So how do you quickly make a diagnosis?
So we make diagnosis by first you must have high index of suspicion for it. In fact, to all specialists, you must note that once any patient is presenting to you all the times and you are not winning, let a pediatric rheumatologist see. It could be in the neurology clinic, dermatology clinic. You've been struggling with that rash, or you are struggling with a patient with alopecia. Why not a patient with hair loss? That's alopecia. Why not refer to a pediatric rheumatologist? Now, once they get to us, we take a detailed history, and from that, we'll also be able to say, okay, this may be lupus. Then we take blood samples, we send to the lab where we analyze. And what do we want to discover? To discover if that person has antibodies, you know, that is in keeping with that diagnosis. And from there, we can now start to talk about treatments.
So now, coming down to treatment now, I want you to take it in two-pronged approach.
Yes.
You being the specialist, you have the expertise to say this is what it is.
Yes.
This is what we need to do. But back home, are there, with regards to treatment, home remedies, what the parents should do and how they can also help in complementing what you will recommend in the treatment modality? And so in that setting, hospital setting and home setting.
Well, we will just a balanced diet.
Okay.
You give them balanced diet. They should ensure that they take their medications.
Okay.
They should avoid high-calorie diet, because some of our drugs are associated with weight gain already. You don't want to feed them heavily.
Really?
Yes, those are the ways to help them. Then it's always good to, inform the school, because that kind of child may be tired sometimes, feels like sleeping, and lecture is ongoing. When the teacher is aware, that child doesn't need to be punished. Once they know that this is the situation, when you talk about management, it's encompassing. Everybody needs to be involved. The doctor, the parents, the teacher, the school, so that the child can be properly managed, and that child should be able to have a good health-related quality of life. Should be able to achieve their life potential. So these are some of the things the parents can do. High calorie diet should be avoided as much as possible, and they should feed them with good balanced diet. Then we give other things when going under the sun. We ask them to use sunscreen on sun exposed areas. We don't want them to fall ill, so that they don't need any hospital admission while taking their drugs. Very important. While taking their medications, very important. So once they adhere to this and they come for regular clinic follow-up, they are fine. We have quite a lot of them that are doing well in the clinic.
Right. So I just want to ask, because I remember when the last time you were here, when we were talking about the JIA, right?
Okay.
Juvenile
Idiopathic arthritis. Yes.
We saw that it could be progressive.
Yes.
After age 16, it can actually progress to rheumatoid arthritis.
Yes.
So for the case of lupus in children,
Yes.
is it still progressive? Are you able to nip it in the bud at this stage, or they can still come down with it, full lupus in adulthood? So what am I saying? What is the outlook, the long-term outlook of lupus in children?
Yeah, what we do most times is that they transit to the adult side through transition. By the time, we keep them till the age of 18. By the time they are 16, we start to counsel them. That's very soon. You won't need to be coming to my clinic again.
I'm very sad for them.
Yeah, they don't want to go. You need to be seeing
it's good informing them.
Yes, 2 years before.
But imagine children, a child that you've taken from childhood.
Yes.
And now you want to move to somebody else.
Yeah.
You probably just have that kind of crisis.
Yes, yes. So what we do, and you know that around that time, most of them are gaining admission into the university.
That's it, yeah.
So they can't be seeing pediatricians as they are adults. So by the time they are leaving, we give them referral notes, detailed one, to the state they are going, probably to an adult rheumatologist. Follow them up on phone and on email.
Long-term outlook.
Long-term
Are they able to live with it for life?
They are able to live with it for life, if only they can adhere to their medications.
So the medication is for life?
Yes, right? Medication is for life. But early presentation remains the key. We don't want a situation whereby by the time they present, they need dialysis for life. You know, that outcome, it's not a good one. Yeah. They need dialysis for life, or probably they have what we call alveolar lungs bleeding into the lungs, and they die while with us. Early presentation remains the key. Imagine diagnosing lupus when it's still limited to the skin and to hair loss. That's without organ involvement. There is good prognosis for that kind of patient than the one that is coming with organ damage. Prognosis is poor with organ damage. So if we catch them early, we are able to transit them to the adult side, and they will live a normal life, a relatively normal life.
All you have said is that there's no cure.
There's no cure. It's lifelong.
So, Dr. FALEYE, this particular question, as we round up, right? If a parent, one of the parents has SLE, system lupus,
yes,
would you advise that the parents should actually screen their children, whether they are not presenting with anything, just for whatever it is, like a part of a preventive measure? Yes.
We don't do that routinely. To be honest with you, even to screen a patient for lupus is very expensive. Yes, we don't do that routinely. Though we have some women with lupus that will come to the clinic because they are already, they live with fear, they are anxious. Yes, any little thing in their child, they feel it is lupus for us to screen. So, but it's not like we screen all their children routinely, except there are, symptoms on the child, or probably there are signs that could make one to have high index of suspicion for it in that child. So we don't do that routinely.
Okay. So something very important, I think, I'm sure our audience will want to know, for the female, because it's more common in females, right?
Yes, more in girls.
In girls.
Yes.
Okay, so for those that are within the age of marriage, that want to get married, right?
Yes.
What counsel, is there anything that will limit them for childbearing in future? Are there possible complications that we need to also know about? And are they allowed to also marry somebody, probably a male who also has lupus?
Yes, there's no contraindication to that. Okay. They can marry each other. But the issue is this. Right from the time of childhood, we need to tell them, some children become sexually active on time. You need to let them know that you should not get pregnant before you can get married. At least inform me 6 months before, let me adjust your medication. I may even need to change
Okay.
that medication. Come and report to me that probably you want to get pregnant. And this applies to women too in their adult clinic. They need to inform their doctors about every step they want to take in their life that has to do with reproduction. So that if you need to change a medication, you need to change it. So that if you need to reduce the dose of a particular medication, you need to reduce the dose so that you can follow them up. But I've not seen it anywhere where we can talk about maybe somebody with lupus cannot marry another person, and that doesn't mean that they will have children with lupus.
Yeah,
that doesn't mean, but
thing.
they must carry their doctors along to find out, because even before you can talk of pregnancy, that means your disease must be quiet, not active. You must be stable. Your kidneys are fine, your heart are fine.
Some of the medications they're using can actually inhibit or cause more challenge to them if it is not reduced before getting pregnant. So thank you for coming on our program again. Can be rest assured I will call you again. It's not easy having you come from the museum. Come and be our guest.
Thank you very much.
So for our viewers, I just want to say thank you for being part of our program today. You've heard so much about lupus in children. It is an autoimmune disease. Autoimmune means that the disease that fights its own body. The body is fighting itself because of some antibodies that have been produced. The antibodies are actually supposed to protect you, but unfortunately, the very toxic ones, when produced, begins to attack itself, and it feels that it's fighting a foreign body, but it is you that it is fighting. So, and for children, we don't have a lot of, we don't have many pediatric rheumatologists. We're lucky to have Dr. AYODELE FALEYE as a pediatric rheumatologist in Nigeria. For now, she's still the only one. So if you have anything that has to, any child that you suspect has been having all these signs and symptoms that I've talked about, don't just forget, just go to a doctor, complain to a doctor, and let the doctor know that you can actually visit a rheumatologist. And then I want to say thank you for being part of us again. I am Dr. Martina Agbemi. Till next time, stay blessed.
Thank you very much, Dr. Faleye. It's always a pleasure having you on board. To our viewers out there, I'm sure you are taking away very vital information with regards to the topic of discussion today, lupus in children. If there's any high index of suspicion that this child may be having any of the symptoms we talked about, please make sure the child is referred to a specialist as soon as possible. You've heard it from her, there is no cure, but the disease is treatable. Be kind enough to follow us on all our various social media platforms. And if you want to be a guest, just like Dr. AYODELE FALEYE, you are just a click away. Go to our website, thephysicians.com, and fill the form, and you'll be right here to share your own wealth of knowledge. Whether you are a doctor, you are a nurse, any healthcare practitioner, even a health enthusiast, or you have a health challenge you want to share with everybody, this is the right platform for you. My name is Dr. Memuna Yusuf Kadri. Until next time, remain blessed.
Every day and in every way, enjoy that I fight support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Diagnostic nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diagnostic from LB Pharma. Diagnostic, love yourself.